Hi, I'm Fara Sax, and this is the Community Voice. Welcome. On today's show, we will navigate and explore Medicare for seniors. So, if you have a senior or have a beloved senior in your life, there's important information you should know. My guest today is Caraline Coates. She is Humana's Florida Medicare president. That sounds like a mouthful, and you cover a lot of areas.
Yeah, it is. It's a big role and an exciting one. Thank you for having me here.
Thank you for joining us. And let's navigate together and explore what is Medicare for our audience. It's such a daunting task for one that is involved, and we'll get into that. And I want to know a little bit about your history. It seems like Medicare has always been in your bloodline, and Humana has been in your life for over 15 years.
That's right. Yeah, I've just celebrated 15 years at Humana and have had a lot of different roles. Humana's been in the Medicare Advantage space for years, and we've evolved over the years. Before I started at Humana, we owned hospitals and skilled nursing facilities, and today we're largely focused in the Medicare space. And so we've evolved as the population has evolved, and the Center of CMS has evolved in reimbursement with Medicare and kind of followed what seniors need in their benefits, not just clinical, but social. So my background's been working with hospitals and physicians and also the community organization. I've led a lot of Humana's, what we call our population health work, and really understanding not just the clinical barriers to those to achieve their best health, but the social barriers. Do we have access to healthy food? Are we near parks? Do we have a caregiver circle around us? What are all these things that really affect the quality and quantity of our life? And I guess the why is we all get older, right? I'm getting older. My parents are getting older. We have a myriad of issues. And so I'm passionate about being part of building a better infrastructure to take care of our clinical and social health as we age.
And it's interesting because, I never thought my parents were going to get older. I shouldn't say that, but getting older and what does that mean and how do we navigate that? And my husband just got on Medicare, and it's a coming of age kind of thing. It's leaving things behind. It's moving forward. And how in our senior years can we really be vibrant and really provide health care to our loved ones, and for myself, my husband in that, and really live a fulfilling life. And we were talking about your parents aging as well, and what that means and how difficult that is, and I'm sure our audience is dealing with this. And how do we know? How do we know which is good for us and what would be the best plans?
Right. All great questions. And I think you said it perfectly well. It's aging in a way that we can live a good quality life. So getting older isn't bad. Getting older is good, right? And that's what I'm really passionate about. Getting older can be great if you feel good, if you have resources clinically and socially, if you know how to navigate the system, which is daunting and overwhelming. So yes, when you turn 65, you're eligible for Medicare healthcare coverage. You actually can sign up for it 3 months before your 65th birthday. And the easiest, simplest way is to just go out on medicare.gov and kind of navigate the site. It will guide you toward different Medicare Advantage plans that may be available in your area. I work for Humana, so another site to go to would be humana.com. And I'm proud that we offer a lot of different products depending on what you need. If you're looking for more choice, if you're looking for some financial relief to use on a card, for example, at a grocery store, if drug coverage is really important to you, co-pays are really, so everyone is different in what they need, and you can change every year during the annual enrollment period. But just at the risk of oversimplifying, again, I'd guide people to medicare.gov or a humana.com or another Medicare Advantage site to kind of navigate, what those options are. And what you need today is probably going to be different than what you need next year or 5 years or 10 years. And so the benefits change, the network changes, but to start there and just increase your own education and awareness for yourself or your loved one or your significant other on what's available.
Absolutely. And like Medicare and then Medicare Advantage. Medicare Advantage is a longer title, but what is the benefits and how do we decipher which one would be an advantage to what we need for our loved ones?
Yeah. So traditional Medicare offered by the government when you turn age 65, there are two parts to it. Part A and Part B. And Part A covers what you would think of more as your hospital coverage if you have to go to a facility of some type. Part B covers more of that physician coverage if you're going to a physician's office and the copays and different components associated with that. Medicare Advantage has combined those, and so we call it Part C.
Oy vey.
Yeah, and to overcomplicate it, but I think is probably the best part, is it also includes what we call Part D, as in dog, which is our drug coverage. And as we get older and different pharmaceutical options are there, that becomes very, very important. So Medicare Advantage is known as Part C, which includes all of that, the A's and the B's and the D's. And it includes a lot of other benefits depending on the plan and depending on where you are. Things like healthy cards to use at grocery stores, fitness benefits, hearing and vision, dental our oral health is really important. And so Medicare Advantage plans have found a way to combine all of that and not just address maybe your clinical needs, but what do you have outside of your clinical diagnosis that may be important for you to have access to reach your full quality of life.
So silver sneakers is one of those like, oh, silver sneakers. Do we get silver sneakers?
Yes.
What's that about?
Yes. Silver sneakers is fantastic. So it's known as a fitness benefit that is offered by many Medicare Advantage plans. And
so it's an Advantage only option.
Correct. It is an Medicare Advantage only option, or otherwise known as a private Medicare plan. Humana offers silver sneakers on many of its plans. Known as a fitness benefit, I personally love it because it's not just fitness. It gets people connected. And there's so much importance about social connectivity and just kind of having a community. I think we all felt that during the pandemic, there's differences between being socially isolated or lonely. And we all found different ways to combat that. But any type of fitness benefit is highly encouraged and usually offered by different Medicare Advantage plans, not only because of the obvious physical benefit, but that sense of community and connectivity that really addresses our whole health.
And I think when people get a little bit older, there is that feeling of maybe some depression that goes along, that there's some things are not as connected as I in my life. My friends are maybe not well or passed, and my kids have moved away. So that really is a really important community connection for elderly seniors.
It absolutely is, and it hits me hard when I think of my own parents. So they've been married 61 years, so they're together.
God bless them. What's their names?
Yeah.
What's their names?
Beverly and Bill.
Beverly and Bill, we shout out to you for 61 years.
Yeah.
We're going to have them on the show, and we're going to talk about how they did it.
There you go. Yeah, they have lots of secrets. They have 5 daughters, I'm one of them, and 17 grandkids.
God bless them.
But my dad's lonely because my mom has Alzheimer's. So he's not socially isolated. He has a lot of people around him, but that woman who's been by his side for years, he can't converse with and engage with in a happy way that he used to. And so he's lonely. And so I bring that up because loneliness and social isolation, food insecurity, these aren't just ailments, if you will, that affect certain populations. They're population agnostic. I say all the time, my parents are arguably food insecure.
What does that mean?
They can afford meals. They don't have access to healthy food because they don't know how to use the kitchen anymore. So they go out to eat. And the out to eat meals. My father has congestive heart failure. He thinks soup is healthy. Soup has a lot of sodium in it. So food insecure is having access to healthy food, and that comes in all different shapes and sizes. It can be financial access, but it can also be just educational awareness on what to eat. And or you know what to eat and you know where to go to get it, but perhaps you have a transportation barrier. And so these are the types of things that Medicare Advantage plans like Humana really try to invest in from a benefit perspective to make sure our members, our communities, the people who we kind of wrap ourselves around to make sure they're healthy are being cared for, not just in the doctor's office.
So let's talk about some of those extra benefits that when they're trying to decide where to go, if they should go with an Advantage plan or just Medicare plan. What are some of the things that Humana offers that might not be in, it's in the fine print and you have to like squint to see what it actually is, but what are those benefits? Let's share those.
Yeah, at the base level, I think a lot of people want to make sure their doctors in the network, their hospitals in the network. So I think we have a very robust network, but I'd always encourage people, if there is a physician or a provider who's very important to you. I think Humana has a robust network just to make sure that that gap is closed. And then in addition to your hospital and physician coverage, there are many things we call a healthy options card I'm really excited about, and that's where we've combined put a lot of dollars on a card, and it varies where you are in the state of Florida and what type of plan, but upwards of close to $3,000 a year that you can use this cash at grocery stores for food. You can use some of this cash if you have it available each month towards your rent. We all know that our rent's going up, and having affordable housing is a challenge for many. You can use it for pet food. You can use the dollars for utilities. So this is a card. Think of it like a Visa card that you can use. And then there are additional dollars, right, in flex benefits that can be used at the dentist office, for vision, for hearing. We often find hearing loss is a huge correlation with feeling lonely. So, a friend of my parents, in fact, seemed really disengaged at social events, and we thought she must be depressed or something's wrong. And long story short, she was losing her hearing, got her fitted for some hearing aids, and she kind of came back to life. Didn't know that her Medicare Advantage plan covered the cost of those hearing aids. So,
are there people in the plan for that, or you can go to one of the big box stores?
There are many different devices that are covered, and it will vary by plan, and it will vary by product within your plan. So I would just advise going to that particular plan site or connecting with the person to whom you bought the plan through, and they can guide you.
So it's Medicare.com or Humana.com.
Medicare.gov.
Oh, gov, thank you.
Yeah, or Humana.com would be two resources I'd guide folks to see what's covered and how they can access some of those benefits.
Absolutely. And what are some of the non-cost services that Humana provides?
So we have, depending on the plan and where you are, many of our plans have the $0 copays and $0 premiums. We call a maximum out of pocket, which is really important to know. Gosh, we don't know what's going to happen in our health, but what's the worst case scenario? So we offer some very low options around that.
What is that?
Meaning the maximum out of pocket you might pay a year might be, depending on where you are, $1,000 or a couple $1,000. In some plans, it's $500. That is, regardless of what happens to you, that's going to be the maximum financial amount that you'll pay out of pocket for your healthcare needs.
So in Humana, the Humana brand, Medicare, there's different options. So there's Humana, there's Medicare Advantage, but in there is other opportunities with a little bit higher deductible. Is that what you're saying?
That is correct. So Medicare Advantage represents all of those Part C plans, all the private Medicare plans. And within those plans, there are different products. So there's all the alphabet soup, right? HMO, PPO, and HMO is typically going to come with a more of a referral type model. And the primary care physician who's using those referrals typically has great relationships with specialists in the community, can really help quarterback your care. But depending on the HMO, the PPO, you may be eligible for Medicaid in addition to Medicare, which will put you on what we call a dual plan. So it's Medicare and a Medicaid, and that will come with much reduced copays and options on the plan. So the out-of-pocket and the cost share, it's complex, and I know, and it does vary. Again, talk on the Humana.com site. There is a number you can call and speak to someone locally in your area.
That was my question. You can take my chair now. You can go back and forth.
Like a sales agent, and we'll help navigate and walk you through the ABCs of the different products and plans, and really listen to what your needs are and help guide you to the best plan.
And do the plans change every year?
They do, just to make things more complex, right? They change.
Why not?
So the industry, not just Humana, has what we call an annual enrollment period, and it's every year between October 15th and December 7th. And this is when you get inundated with commercials and ads, because we're all trying to sell our new products and plans. And that is when you can switch every year. You can switch at other times if you have an event or chronic condition or certain things might happen. But again, I would go to that Humana.com site, find a number, an agent, and talk through. But that annual enrollment period is the same every year.
Okay, got it. And let's talk about the Inflation Reduction Act and how that has impacted prescription drug costs and how this might help the folks that are seniors looking to jump into the arena and get good quality care.
Yeah, I think we hear the word inflation and we think not good, but in the Inflation Reduction Act of 2023, this is a good thing that provides more coverage for seniors around vaccines. For example, shingles is now covered, and they instituted, they being the government, which now all Medicare Advantage plans will follow this lead. So this is consistent across all things like insulin coverage is capped at I think it's $35 for kind of a 1 month supply. And so there are kind of some protection, on certain things like insulin that many are needing if you have diabetes, and or vaccine coverage.
Interesting. And it's so interesting. We're talking about how healthcare, and what you know. But what about proactive care? How can those that are watching that have senior parents, senior loved ones, or themselves be more proactive? It's such a buzzword these days.
Yeah, proactive, preventative care. We all know it's important, right? There's a statistic, depending on which one you reference, that 60 to 80% of our quality of life is dependent on our social health needs, not our clinical. Not that clinical diagnosis, but it's all the social stuff around you. It includes your genetics, it includes your environment, it includes what you're eating, who you're interacting with, your social, are you close to parks, are you all of that? And so some of your diet, your exercise, your social connectivity, understanding your risks, understanding from where you come, should you modify your diet. Those are all steps to take towards living the healthiest life possible, right? And not waiting till that acute event. And so really investing in your own health care, and back to the fitness benefit, and engaging with people, and being social, and kind of finding your own community and your culture and population that you can really thrive, knowing that some clinical ailments may be coming your way. Mm-hmm. But if you're kind of ahead of the game a little bit in a healthy diet and exercise and social connectivity, it will help elongate that quality of life.
That's well said. It's so important and so many different levels. It's interesting, you're probably seeing that with your family, because I see that with my mother and my father who passed. It's just, how do we age graciously and gracefully and give it the best possible outcome as we get started on the road. It's a very interesting, when you're 20, you don't think about that.
Right.
But as you move forward and you see that, it's so good that Humana is around for the community to really help engage and help them navigate this.
Yeah, and we really try to understand what our community, what our population, what our members, what's important to them. And so you hear about value-based care, but there's another way of looking at that, and not value to the plan, but what's the value to the person. And so many of our physicians with whom we partner are great at this, and they'll understand their particular patient. The doctor may worry about their diabetic A1C level, but understanding that the person is more worried about going to their granddaughter's wedding. That's value-based care. That's understanding what's of value to that person. And if we understand that, and we have so much data on everyone, every people, if we understand what's important to our members, our community, then I think we can continue to invest in the right benefits to make sure they're living the most valuable life and what's important to them.
And I find that when going to the doctor, when I've gone with my parents, it's like you want to be their mouthpiece, and yet a senior really needs to speak up for what's going on. They need to have that communication with their doctor, with their practitioner, so that sometimes it's a physical thing, but it's also some other stuff underlying. So having the communication, having that one-on-one with the doctor, and does Humana provide that platform of, time? I think seniors need time. We all need time with our physician, and in this hurried, crazy market that we're living in medically, how do we have that voice speak so that the doctor hears and receives the information that needs to be translated, and so we can get better, or our families can live happier?
Yeah, I think you hit the nail on the head with time. And we're all born with the same amount of time when we wake up in the morning, we all have the same amount of time in a day. One way I think the industry has found a creative way to give some time back is through the way we reimburse. provide physicians. You may think that's odd, right? But instead of reimbursing them for just how many patients they can see or how fast they can go, you may hear value-based payment care
versus the fee-for-service model.
Correct, more that kind of fee-for-service where it's a per-click kind of a thing. So in a value-based model, which is how we reimburse all of our primary care physicians in Florida for over over 500,000 of our seniors, is based on
500,000 of your seniors.
Yeah.
You deal with 500,000 seniors. That's a lot of fetching.
Yeah, it's a lot of people to make sure we work. It takes a village. That we work with everyone to create the ecosystem that they need in their community and their culture. And part of that is with the physicians and making sure that we reimburse them based on outcomes and how they address the whole person health needs and not just that particular clinical diagnosis. And when you reimburse on outcomes, you get into a value-based model where there's dollars that are generated for them that the physicians reinvest back into things like transportation. You see vans driving around and helping people get to and from appointments or perhaps to a community center or to play a game with a group of friends. And so that's how we repurpose dollars in a different way to invest back into the community to address those whole person health needs.
Getting back onto financial, what is the financial impact when understanding benefits? Like, how does that happen with seniors living on fixed incomes and then the inflation and groceries and rent? You were hitting on that a little bit.
Yeah, I think that's where a lot of these newer, we call them supplemental benefits, come into play. So they're not just addressing that payment when you're admitted to a hospital or that payment when you're at a doctor's office, but there are benefits that provide some financial relief, not just in copays, but also the dollars to use at a grocery store. Or
those are that credit card
that is
that
that
we were
credit
talking.
card, right? Or to use toward your utilities or rent. And in knowing, when a person comes in and maybe they're complaining to the care manager or the nurse that their rent was just increased, to connect those dots and say, hey, do you know you have this spending account, a card with Humana that allows you to apply some of those dollars that may give you some of that relief. Because yes, we're all facing some increased costs and inflation and on many things. And so if we can repurpose the dollars and in a way that help provide financial relief to our seniors for their health care and not just clinical, then I think we're doing some good work.
Absolutely, and you've been doing this for quite a while.
Yeah.
The Advantage Plan, let's talk about the benefits with prescription drugs.
So in a traditional Medicare, not just the government, that A and B, back to the alphabet soup, there is no drug coverage. And so that's why Medicare Advantage or the private insurance plans have taken that A and the B and combined it with the D, which actually stands for drugs, Part D.
I feel like I'm like in an algebra class right now. I didn't do very well in algebra, so okay.
Yes, and so there's a ton of prescription drug coverage. And it's going to vary a little bit by plan, a little bit by product. And so again, I'd go back to that Medicare.gov site that will lead you to different plans and outline your prescription drug coverage, or the Humana.com site, and find that number and call someone and talk through what maybe drug prescriptions you're on, connect with your physician and kind of go through that. Usually they'll know some good options for you, but there are varying levels of prescription, and some plans covering nearly all of your prescription drug costs on a Medicare Advantage plan.
So Caraline, on a personal note, what makes you get up in the morning? What excites you?
About everything we're talking about right now.
I could tell.
So, I have 2 boys, 7 and 8 years old. So got a long road ahead with them.
See, I never had boys, but I have a grandson, and when he flies off the couch, I'm like, I have girls that were like very easy, and so the physicality is completely different. So I can only imagine your house.
We have a very active household. If I can leave this world a little better for them, that's what motivates me. And when my youngest graduates from high school, our country will have more people over the age of 65 than people under the age of 18 for the first time ever.
Say that again, because that is an amazing statistic.
And we're all part of it, hopefully, knock on wood, right? In 11 years, I forget the actual year, about 10, 11 years, our country will have more people living over the age of 65 than under the age of 18 for the first time ever. By 2050, we will have tripled the number of people living in their 90s and their 100s. This is modern medicine, and its prescriptions and its procedures, but it's also all this preventative work that we're talking about. And it is work. It is work to eat healthy and to take time for yourself and to surround yourself by healthy habits. But we're doing that and we're moving in that direction. So what gets me up every day is to be a voice and a person who is fundamentally helping change the ecosystem we live in the world, whether it's our parks, the food we eat, the people we interact with. So we are living a healthy 70, 80, 90, 100-year life. And to leave the world a better place for my kids.
It's so well said. And then you do also a lot of charity work. You give your time to some really great organizations.
A lot of organizations do great work, and it's a matter of finding time. Because I'm so committed to Humana, I'm on the board of the Humana Foundation, and Florida in particular. Is
Like how many different counties do you have to deal with?
And I'm on the board of Health Foundation of South Florida. Given that our community here is South Florida, I have to put a plug in for them. They're a ton of great work, and both of those organizations are doing a lot of work on what we call going upstream and investing in what's maybe not important today, but what's important tomorrow and the next day, and really get at the root cause of the root cause to change and improve the community that we live in. So not only our parents and our grandparents, but our grandkids can live a long, healthy, quality life.
The time we have left, anything else you want to share with our audience, with me, in this quiet little setting? It's just you and I.
Yeah, I think when we think about healthcare, it's not just what happens at your doctor's office, and it's not just that clinical diagnosis you get. It's your mindset. It's your friends, it's your family, it's the grocery stores you go to, it's our community, and we all play a role in improving the health of our community. And I'm proud to be a member of the South Florida community and hopefully part of improving its overall health.
You are magnificent, the work you do, Humana behind you, and the years of dedication to the community and making a difference in people's families' lives, the seniors' lives, and every generation below that. So may you enjoy your boys and as they fly off the couch often. And I want to say thank you for joining me today and taking this time. Humana.com or Medicare.gov for more information. And I want to thank you for being here today and joining me on the Community Voice. I'm Fara Sax. Until next time, take care of each other.